Haemolytic disease of the fetus and newborn, or HDFN, is a blood disorder. It affects newborns and, in some cases, fetuses during pregnancy. HDFN occurs due to an incompatibility between the mother's blood type and the baby's blood type. This incompatibility triggers the mother's immune system to attack the baby's red blood cells. HDFN is a relatively rare condition, but it can have serious consequences if left untreated. Fortunately, with early diagnosis and proper management, most babies with HDFN can lead healthy lives. This essay aims to provide a comprehensive yet accessible guide to understanding HDFN, its causes, symptoms, diagnosis, treatment, and prevention. Understanding HDFN involves delving into the complexities of blood types and the immune system. It requires comprehending how a mother's body, designed to nurture and protect, can sometimes turn against the developing fetus. This guide will navigate these complexities in a clear and straightforward manner. By understanding HDFN, expectant parents and individuals alike can be better equipped to recognize the signs, seek timely medical help, and ensure the well-being of both mother and child. The root cause of HDFN lies in the difference between the blood types of the mother and the baby. Human blood is categorized into different types, the most important being the ABO system, AB, and O, and the Rh system, which can be positive or negative. Problems arise when the mother's blood type is Rh negative, and the baby inherits Rh positive blood from the father. During pregnancy, small amounts of the baby's blood can enter the mother's bloodstream. If the mother is Rh negative and the baby is Rh positive, the mother's immune system sees the baby's Rh positive blood cells as foreign invaders. The mother's body then produces antibodies, special proteins designed to destroy these foreign cells. These antibodies can cross the placenta, the organ that connects the mother and the developing baby. Once in the baby's bloodstream, the antibodies attack and destroy the baby's red blood cells. This destruction of red blood cells is known as hemolysis, and it can lead to a range of complications. The severity of HDFN can vary greatly depending on several factors, including the amount of Rh-positive blood that enters the mother's bloodstream and the mother's immune response. In some cases, HDFN may be mild and cause few problems. However, in other cases, it can be severe and even life-threatening for the baby. Understanding the mechanism behind HDFN is crucial for appreciating the importance of early detection and treatment. By identifying the mismatch between the mother's and baby's blood types early on, medical professionals can take steps to mitigate the risks and ensure a healthy pregnancy. The symptoms of HDFN can vary depending on the severity of the condition. Some babies may show no symptoms at birth, while others may have mild to severe complications. Mild cases might present with slight jaundice, a yellowing of the skin and eyes due to the buildup of bilirubin, a byproduct of red blood cell breakdown. More severe cases can lead to significant anemia, where the baby doesn't have enough healthy red blood cells to carry oxygen throughout the body. This can result in paleness, lethargy, and rapid breathing. In extreme cases, HDFN can cause hydrops fetalis, a life-threatening condition characterized by fluid buildup in the baby's tissues and organs. Diagnosing HDFN typically begins during prenatal care. Expectant mothers are routinely screened for blood type and Rh factor. If the mother is Rh negative, further testing is conducted to determine if she has developed antibodies against Rh positive blood. This usually involves a blood test called an antibody screen. If antibodies are detected, the father's blood type is also checked. If the father is Rh positive, the baby is at risk of developing HDFN. Throughout the pregnancy, the mother's antibody levels are closely monitored. Additional tests, such as amniocentesis or Doppler ultrasound, may be used to assess the baby's health and the severity of the condition. Early diagnosis is vital for the effective management of HDFN. By identifying the condition early, healthcare providers can prepare for potential complications and intervene promptly if necessary. Section 4. Combating the condition, treatment and management. The treatment for HDFN depends on the severity of the condition and when it is diagnosed. For mild cases detected after birth, phototherapy, a treatment that uses special lights to break down bilirubin in the baby's skin, may be sufficient. In more severe cases, an exchange transfusion might be necessary. An exchange transfusion involves slowly removing the baby's blood and replacing it with blood that doesn't have the Rh antibodies. This helps to reduce the levels of bilirubin and increase the number of healthy red blood cells. In some instances, particularly if the condition is diagnosed during pregnancy, intrauterine blood transfusions might be performed. This procedure involves transfusing blood directly into the baby's circulation while still in the womb. While these treatments address the immediate effects of HDFN, preventing the condition from occurring in the first place is paramount. This is where preventive measures come into play, offering a safe and effective way to protect future pregnancies. Section 5. Prevention is key. Safeguarding future pregnancies. The cornerstone of HDFN prevention is the administration of Rh immunoglobulin, also known as RhIg, or RhoGAM. RhIg is a medication given to Rh-negative mothers to prevent the development of antibodies against Rh-positive blood. It works by neutralizing any Rh-positive blood cells that may have entered the mother's bloodstream before her immune system can recognize them as foreign and produce antibodies. RhIg is routinely given to Rh-negative mothers at around 28 weeks of pregnancy, and again after delivery if the baby is found to be Rh-positive. It is also administered after any potential exposure to Rh-positive blood, such as during miscarriage, ectopic pregnancy, or certain prenatal procedures. The effectiveness of RhIg in preventing HDFN has been remarkable. Since its introduction, the incidence of HDFN has significantly declined. However, it is crucial for all expectant mothers, especially those who are Rh-negative, to receive proper prenatal care and discuss their blood type and Rh factor with their healthcare provider. Section 6. The importance of early intervention. Haemolytic disease of the fetus and newborn, though a complex and potentially serious condition, is largely preventable and treatable with early intervention. Understanding the causes, recognizing the symptoms, and seeking timely medical care are crucial steps in ensuring the well-being of both mother and child. Timely prenatal care, including blood type screening and Rh immunoglobulin administration, has proven instrumental in reducing the incidence of HDFN. By empowering individuals with knowledge and promoting awareness, we can strive to create a world where HDFN is no longer a threat to newborns and families.